as I look back on the last year at the ABIM Foundation, I'm really proud of the progress we've made in building trust and advancing medical professionalism. We have so much to celebrate, especially as we welcome Furman McDonald, our new president and CEO for both ABIM and the foundation.
Thanks, Jess. It's an honor to step into this role after 10 years as Senior Vice President for Academic and Medical Affairs with ABIM. I've witnessed a tremendous impact both ABIM and the foundation have made, and I'm excited to deepen our work together, building trust and creating a more equitable health system.
Building trust across healthcare remains a priority for the ABIM Foundation. We're actively testing strategies to help health systems build trust with their communities and workforce, and funding the development of an assessment tool with the Institute for Healthcare Improvement that health systems can use to evaluate their own trustworthiness. At the same time, we recognize that rebuilding trust also means addressing financial barriers to care for patients. Medical debt in the U.S. is a pressing issue affecting more than 100 million Americans and severely diminishing both patients' trust in the healthcare system and their ability to access care when they need it most. In June, we brought together more than 60 leaders and advocates to discuss best practices, policy changes, and collaborative approaches to address medical debt and rebuild trust in healthcare. We're now funding research with Academy Health to explore how systems can best reduce the prevalence and impact of medical debt.
In 2020, ABIM and ABIM Foundation made a public commitment to examine our role in perpetuating racial disparities in healthcare, whether intentional or not. We recently updated that pledge to reaffirm our commitment and ensure it remains impactful and focused on the future. In collaboration with the Alliance for Academic Internal Medicine, the American College of Physicians, the Josiah Macy Jr. Foundation, and the Gordon and Betty Moore Foundation, we've awarded more than $1.5 million through the Building Trust Through Diversity, Healthcare Equity, Inclusion, and Diagnostic Excellence grant program, including $400,000 this summer to 16 projects at medical schools and health systems to improve education and build a more trustworthy health system.
And during this year's ABIM Foundation Forum, we brought together more than 120 leaders and stakeholders from across healthcare to explore how the medical and scientific communities can restore trust in our increasingly polarized society. Participants worked over 3 days to develop potential approaches to acknowledge past failures and build trust. Participants engaged in dialogue and formed small working groups to dig in and begin to address issues like medical debt, bias, professionalism, and trust in public health. We also heard from experts on a variety of topics. Danica Young explored how misinformation spreads and the media's role in amplifying it. Tony Mills and Sarah Gorman discussed how mistrust in healthcare stems from a lack of competency, integrity, and equitable access, which can lead to severe consequences for patients. And 3 medical students reflected on their experiences with building trust.
The conversations that we had at the forum will continue to guide the Foundation's efforts to build more trustworthy health systems and have already begun to shape next year's forum.
As we look ahead to 2025, we remain deeply committed to leveraging the Foundation's unique position in healthcare. We'll continue our work, but with a renewed focus on medical professionalism in a shifting healthcare landscape.
Thank you for being part of our journey. Together, we're shaping a future where trust, equity, and the values of medical professionalism are brought to the forefront in care and care delivery.